Hello everyone, so today's presentation is going to be on iron deficiency anemia. So firstly, just before we dive in, what is the function of iron in the body? Iron is important for four main factors, the first being erythropoiesis, which is the formation of red blood cells in the body. So if we go back to the first slide, you can see here showing images of normal red blood cells, and here there is an image of the red blood cells with iron deficiency anemia. As you can see, they're much more pale, much smaller. Iron is also an important component of hemoglobin. So low iron leads to different shapes and sizes of hemoglobin, which disrupts the transportation of oxygen to and from the body, which can lead to signs and symptoms such as dyspnea, which we'll get onto later on in the presentation. Iron is also important for DNA synthesis and cell mitosis and meiosis. Some of the causes of iron deficiency anemia can be acute blood loss. So this is typically prevalent in menstruating women and women with heavy menorrhagia, which is heavy menstrual bleeding. A poor diet, such as a diet poor in meats, red meats, and green leafy vegetables such as spinach, can also lead to low iron intake into the body, and poor intestinal absorption of the iron, especially in conditions such as celiac disease, which may lead to disruption in the intake and absorption of iron, can also lead to iron deficiency anemia. Some of the ways it presents is due to the disruption in hemoglobin formation. You have reduced oxygen transportation throughout the body, so you get symptoms such as dyspnea, as well as the typical symptoms of anemia such as fatigue and dizziness, pallor, palpitations, anorexia, lethargy. We can also see a lot of the signs and symptoms presenting in the nails, the face, the hair. One typically being three key changes in the nails. So firstly, koilonychia, which is spooning of the nails; onycholysis, which is this longitudinal ridging of the nails you can see in the second picture; onychorexis, which is also splitting of the nails due to the nails becoming very brittle and easy to crack. Iron deficiency anemia can also lead to dry skin and dry hair, leading to hair loss, a red, beefy tongue called atrophic glossitis, restless leg syndrome, and ankylostomitis. Some of the ways in which we would investigate iron deficiency anemia is taking a full blood count, where we would see a low MCV count, low MCH, low MCHC, and ankylospoilocytosis, which is different shapes of and sizes of hemoglobin. There would also be a low serum ferritin, a low serum iron and high total iron binding capacity, and a low hemoglobin count overall. Blood film can also show evidence of hemochromic microcytic anemia, which iron deficiency anemia can commonly cause microcytic anemia. To manage iron deficiency anemia, we'd need to replenish the iron source. So this can be done conservatively through encouraging the patient to take up a diet that is high in iron, such as red meats and leafy vegetables. We can also provide iron supplements such as ferrous sulfate 200 milligrams. Common side effects of this can include nausea, vomiting, diarrhea, and constipation. And for women who, even after medical management, still continue to have menorrhagia or very heavy bleeders, gynecological referral is needed. So, in summary, iron deficiency anemia is a very debilitating condition, which is common, especially in women who are menstruating with a poor diet and poor intestinal absorption. Iron is very important for the formation of red blood cells, hemoglobin, and DNA synthesis, and therefore a low iron or iron deficiency anemia can present with a range of symptoms such as fatigue, pallor, changes to nails, skin, and hair. We would treat iron deficiency anemia by replacing the iron source through an iron-rich diet and iron supplements. Thank you so much. If you have any comments, please comment down in the comment section below.